let's say it's a first visit with a patient. It's been referred to you by a pediatrician, and you've made an assessment, and you really believe that this child has ADHD. How would you describe to a parent what's actually going on with the child? What are the deficits he has, and how do those connect to what his brain is actually doing?
Well, that's a good question, and it's one of the parents' primary concerns is understanding what the disorder is. And it involves the prefrontal cortex, the area of the brain kind of near the forehead. And it involves, it's like an engine that controls when kids are active and what they pay attention to.
Okay.
And I've described it, and it works a lot like a gas pedal in kids that don't have ADHD. So in situations where they need to be very active and attend to many things that are going on, like a football game, then that gas pedal can go down, and they're more able to, attend to many things and be very active with their bodies. For kids with ADHD, it's more like a light switch, this part of the brain, and so it's only during times where they're very interested, like the video game or computer time or TV time, things that really interest kids intensely, then the switch goes on, and they're able to filter out other things and control the amount of activity that they're having. And what the medicine does is it comes in and it really helps the child have a brain that works more like a gas pedal again, where they can control the amount of interest and activity that they have, more like their classmates do.
Yeah. So would that explain why many parents get confused about why their kids can attend to a video game but can't seem to attend to reading a book? Or
Yes, it explains it. And what it is that emotional interest really kind of activates that gas pedal.
Okay.
It's one of the factors that presses down on the pedal. And so for kids that don't have ADHD, the pedal works very well. And even in situations where they're not very interested or moderately interested, like doing homework or in school, the gas pedal can go down and they can control how active they are and what they're attending to.
Yeah.
And filtering out a lot of the background noises.
Now you have a great analogy with regard to that I love, that I'd like you to explain to kind of our parents out there. The stop, explain it. It's a stop, think, go?
Yeah, it's a stoplight for
stoplight.
Kids to make decisions that they have to make. And kids with ADHD really struggle with making decisions. Again, back to the light switch as opposed to a gas pedal. And they tend to be impulsively deciding what to do. And so one of the things that I will explain to them and their parents is that making decisions is a lot like a traffic light. And at the top you have a red light, and then you have a yellow light and a green light.
Mm-hmm.
And the red light for people means stop what you're doing. And the yellow light means think about what are some options that are likely to get me what I want, and are not likely to get me in trouble. And then the green is deciding which one of those is the one you want to do. So I'll often draw that out with kids and have them put it on the refrigerator and practice it and tell their parents when they get home how they use the traffic light to make a good decision for the day.
And that points out as well that the treatment for ADHD is not just medication. Psychostimulants are the main treatment, and they're very, very effective because they help activate that part of the brain. But a kid also has to break out of really bad behavior patterns and bad thinking patterns by using that part of the brain once it's activated. Right. So that's why I like that metaphor, because it really is true. Once a kid gets very, very frustrated very, very quickly, he stops thinking. And that's the main problem with kids with ADHD. They're really not thinking while they're behaving. They usually think maybe after they're behaving. And so one of the things I tell parents is not to assume that your ability to problem solve is at the same level as your child's ability. So the child really doesn't know how to generate solutions and needs your help coaching them to think through solutions.
Yeah, it's almost like teaching the child to look down the road at what the light is.
Exactly.
The traffic light, so that they can start to plan. Heading towards a red light here.
Right.
I'm going to have to think about what to do.
Yeah.
for the psychostimulants and the other medicines that work for ADHD. They are very well researched and have a very low side effect profile and tend to work well at lower dosages. And these are the things that often parents want to understand so they can make good decisions and work with their provider about the kind of medicines they want to use as well as when to use them.
Yeah, and I think it's very important to encourage parents to talk very openly about their hesitation.
Yes.
I know it's hard as parents sometimes just to say that you disagree or that you have hesitancy as to what your pediatrician might be recommending, but it's important to engage your pediatrician in that. Well, the combination of medication and working through these kind of behavior and thinking strategies work very well for lots of cases of ADHD. So we definitely encourage parents out there to get the help and get it early on.